some people would simply like to know, exactly what some of these things mean and why they're in the bill. Here we have more information about the what's supposed to be in your end-of-life plan that is on the computer and in your files. The level of treatment indicated under subparagraph A may range from an indication for full treatment to an indication to limit some or all specified interventions. Such indicated levels of treatment may include indications respecting, among other items, just a few, the intensity of medical intervention if the patient is pulseless, which means you don't have a pulse, apneic, you're not breathing, or has serious cardiac or pulmonary problems. Okay, you're supposed to plan ahead of time for a situation where you may be having a heart attack. That would be considered serious. Okay, in the medical field, they list them just like we have our alerts: high alert, medium alert. Well, critical, then serious, then guarded, then stable, I think, are some of those. Serious is not the most serious one. Critical is. But in this, it has, if you have a serious cardiac or pulmonary problems, that could be trouble breathing. That could be the fact that you need a bypass. Serious cardiac. I mean, why is that? Why do you need an end-of-life plan for that? Why can't you just say, help me? If I'm having trouble breathing, give me a respirator. If I'm need a bypass surgery, then give me bypass surgery. But no, they want you to have an end-of-life plan because it may not be worth it to you to continue to live. My dog is whining at me. Stop it, Kiru. Stop it. Go lay down. Anyway. So it's supposed to include this. And then also the individual's desire regarding transfer to a hospital or remaining at the current care setting. Okay, that you get to decide that. That's your desire, not your preference, your desire. The use of antibiotics. That doesn't say your desire or your preference. It just says the use of antibiotics. So this will decide whether you get any antibiotics. It doesn't say your desire. The use of artificially administered nutrition and hydration. Again, it does not say your desire. It just says it will tell them what to do regarding antibiotics and artificially administered nutrition and hydration. Okay? Now down to this in general statement. Here we go. Sorry. The Physician's Quality Reporting Initiative. Now this is an active program where physicians can choose to join a program where they can report quality measures on their patients, the quality of how well they recovered from how well their operation or procedure or whatever went, how well it affected them. They can report those things, and they have an incentive for doing so. They get money, I guess. And this is supposed to be the reason that they added this to the health care bill, is so that it would be an incentive for him to have this interview with you, or him or her. I'm sorry, I don't mean to be prejudiced. Again, I don't mean to be sexist, but your doctor can have this conversation with you and then report that he had this conversation, and that's how he gets his incentive. Now, up until now, there hasn't been any end-of-life type measures in this incentive. Normally they would pick 3 that dealt with the category of health care that they dealt with and report on those. But these are going to be added. In general, for purposes of reporting data on quality measures for covered professional services furnished during 2011 and any subsequent year, to the extent that measures are available, the Secretary shall include quality measures on end-of-life care and advanced care planning that have been adopted or endorsed by a consensus-based organization, if appropriate. Such measures shall measure both the creation of and adherence to orders for life-sustaining treatment. This is where people get their scary death boards, okay? This is where it came from, right here. Proposed set of measures. The Secretary shall publish in the Federal Register proposed quality measures on end-of-life care and advanced care planning that the Secretary determines are described in subparagraph A. That means he gets to decide what these measures are, and would be appropriate for eligible professionals to use to submit data to the Secretary. The Secretary shall provide for a period of public comment on such set of measures before finalizing such proposed measures. Okay? That's what scares people about this page 425. That's it right there. Those things that I read to you are what scare people. And that's what we want answers to. Why that's in there, why it's necessary. Now, this is why I think it's necessary. Because they've been saying it on the news lately. This is their new spin. Well, it's no different from having an insurance company and them choosing what they will and will not provide. That's true. Except when you're on the government program, you don't have anywhere else to go. And there are many of us who believe that this will become a single-payer system because Obama wants a single-payer system. He's been saying so publicly since 2003. I mean, I'm sure you've seen the videos on YouTube where he openly proclaimed in 2003 and in 2007 that he wanted single-payer health care and that this would lead to it. Okay? So you're going to be on this government plan, and even if, okay, let's just say it doesn't force the other insurance companies out of business. The people who are going to be on this plan aren't going to have any other choice. Now, let's just mention inside here page 16 that says that it will run other insurance companies out of business by deleting you from their program. If anything changes, you have to drop the program and go on the government program. That's on page 16, and somebody needs to do a video about that because these are really tedious, and I hate doing this to you, but this is the information. This is what people are arguing about. This is why people are going to the rallies and yelling and making signs and doing things they've never done before. This is why average Americans are going to tea parties and town meetings. This is why. But this isn't the only reason. There's more to it than this. If this isn't enough to scare you, and I know this is going to be a long video, and I didn't want it to be, but I knew it was going to be because there's no way to get all this information out to people without it being a long video. I may have to cut it in half. I don't know. Obama has got in his cabinet a man named Ezekiel Emanuel. Now, Ezekiel Emanuel, Rahm Emanuel's brother, is a bioethicist, and Obama has him on his cabinet as an advisor on healthcare issues. Mr. Emanuel has written many articles for many published journals that pretty much spell out his feelings and understanding of how a perfect medical system would work, healthcare system. This article is supposed to be just about scarce medical interventions. Not, this is not a public plan by any means. This is just if healthcare becomes scarce. Well, if the government takes it over and we're already bankrupt, I think medical interventions are going to become scarce pretty quickly. So let's just see what he says we should do in a situation where medical interventions become scarce. And he bases this on the distribution of vaccines and organ transplants. He's saying, like, every time he refers to it, he's saying, like, organs and vaccines. But this could be applied across the board.